Well, Dr. Gary Morsch joins me now via Skype from the U.S. state of Missouri. He's an emergency medicine physician and the president and founder of COVID Care Force. Dr. Morsch, thank you for coming on the show.
Thank you.
So, 5 million confirmed cases in the U.S. We're soaring past. What worries you when you see the numbers and the rate of infections here?
Right. It's incredible, unbelievable, unprecedented. It's a sad state of affairs in the United States, no doubt.
You founded the COVID Care Force to help fill critical gaps in hospitals and other healthcare facilities. The initiative now up and running for a few months. Tell us how it's doing.
Well, we have been focusing most of our efforts, first of all, in New York City when the pandemic peaked there on April 8th. And we were there before and through the month of April. And New York City did the right things and was able to get COVID under control. It then broke out in among the Navajo Nation. That became a very big hotspot. That's one of our Native American reservations where our American Indians live. And we've been working there now since May. And they have turned the tide. Through strict enforcement of mask wearing, through curfews and other measures, they have turned the tide. And so, unfortunately, in much of the United States, that is not happening.
And so where are you seeing the greatest need for more doctors, more facilities?
Right. Really, it's in about half of the states within the United States, certainly throughout the South, from Florida all the way across to Texas, now in Arizona, in California. So certainly about half of the United States has severe cases, increasing cases of COVID and are very short staffed for doctors and nurses.
Doctor, how would you say treatment has changed since the start of the pandemic? It's been a few months now, and we continue to learn more about COVID-19. What's the medical community doing better now?
I think, you know, we understand the disease, and we learn more every day, every week, of course. There really still is no silver bullet. There's no magic treatment. We don't respond well to whatever treatments we try, and others don't. But certainly using the antiviral medicine remdesivir, we're using steroids. Of course, high-flow oxygen is always a mainstay. We're not putting people on ventilators like we were early on. We now realize that does not really that may even make it worse. So the treatments are still not terribly effective. The most important thing that Americans can be doing, or anyone, is to prevent the transmission of this terrible disease.
I'm glad you brought up the whole subject of a silver bullet, because the whole world, in a way, is pinning hopes on a vaccine to end this pandemic. But even the WHO says that may not be enough. Your thoughts on this? Well,
you know, vaccines are a mainstay of preventing many infectious diseases, and I believe in vaccines, and we all do. But it takes a lot of time and effort to create a proper vaccine. It has to be tested, and you know, we would like to think that we can have a vaccine within a few months, but certainly it's going to be well into 2021, most likely, that there'll be a vaccine approved. Other countries may get them approved sooner, so it's a wait and see. And then we don't know how effective that vaccine will be. The influenza vaccine that we use now in the United States is only effective at best in any given year at 60, perhaps 70%. Usually it's around 50% effective. So if the COVID vaccine is only 50 or 60 or 70% effective, that means you still have millions of people are getting vaccinated that are still prone to getting the disease.
All right. Rough road ahead still. Dr. Gary Morsch, thank you for your time.
Certainly.